Good, happy Sunday evening, March 15, 2020. I'm Riley King, and welcome to this Sunday evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Sunday evening, so let's begin. First up, Governor directs all public schools to temporarily close, turn to remote learning. 6 new COVID-19 cases announced, bringing state's total to 13, officials say. Let's take a listen to that press conference that Chris Sununu had this afternoon today.
Hi, I'm Sherry Allen, proud owner of Mercedes-Benz of Portsmouth. We put every effort into making Mercedes-Benz of Portsmouth.
New Hampshire has rapidly evolved over the past 48 hours. On Friday, we declared a proactive state of emergency that allows us to take preemptive measures to ensure that we have the resources and the flexibility available to respond to this developing health emergency. For many people, and especially our kids, this can be a scary time. There's a lot of uncertainty with what's going on. Our job is to ensure that the people in New Hampshire are safe, they're comfortable, and they're informed. Over the coming days and weeks, more announcements will be made as the situation is constantly evolving. It's important to remain calm, to really be there for our kids, to come together as a community in this moment of crisis. The goal with our communities and with our children is to be resilient, not to panic. Our kids will remember how their homes felt a lot more than they'll remember the actual impacts of the virus. The community and the spirit of the Granite Staters is unmatched. We know this. And when we work together as neighbors and friends, we do it really, really well. I'll now turn it over to Ben Chan for an update on the evolving data and how our actions are designed to limit community transmission.
Thank you, Governor. Let me start by first giving an update in terms of the number of cases of COVID-19 which have been identified or diagnosed in New Hampshire. Today we are announcing a total of 13 individuals in New Hampshire with COVID-19. That is an additional 6 individuals since our last report on Friday. All of these new cases are believed to be travel-related, either international travel, as is the case with 4 individuals, or domestic travel, as is the case with 2 of the individuals. I also want to make mention that late Friday evening we announced a 7th case, but had not identified or announced specific risk factors for that individual. We have since learned through our public health investigation that the case we announced on Friday did have domestic travel in the days prior to illness onset, and so we believe that this 7th case is likely to also be a travel-related infection. So to summarize, in total we have 13 COVID-19 cases identified in New Hampshire. All of them, we believe, are either travel-related or are identified close direct contacts to someone with COVID-19 diagnosis. None of these individuals are hospitalized. They are all at home with more mild illness. There are now more than 150,000 global cases of COVID-19 and close to 3,000 cases of COVID-19 in the United States, including the 13 individuals identified now in New Hampshire. As COVID-19 increases globally and as we see spread throughout the United States, we can expect more diagnoses of COVID-19 in New Hampshire in the coming days and weeks. It will become increasingly difficult to determine specific risk factors for acquiring COVID-19, and so it's very likely we're going to see additional diagnoses of COVID-19 where we are unable to or have difficulty identifying specific risk factors. So in short, there may be additional COVID-19 cases in the coming days where there is not a clear identified risk factor, and there may be evidence of community transmission. I think that's expected given the rapidly expanding global outbreak in multiple other countries, as well as the increasing numbers of cases within the United States, including in states surrounding New Hampshire. In this setting of the new coronavirus pandemic, I want to stress and iterate that we need everybody's help to help prevent spread of this new virus and to protect our families and our communities that we live in and those who are most vulnerable. So it's our collective responsibility to help slow the spread of COVID-19 in New Hampshire and around the United States. Now, there's been a lot of discussion and speculation about how COVID-19 spreads. There's been some discussion and concern that there may be asymptomatic transmission of COVID-19. And I want to reiterate that we know, and as I've said previously, we know from case reports in the scientific literature that transmission of COVID-19 is certainly and likely possible before someone develops symptoms. But we still believe that the main driver of this pandemic is in individuals who are symptomatic and exposing other people. This includes people who may only have very mild symptoms of COVID-19. So we also know that people with COVID-19 can shed virus or spread virus from their respiratory tract even very early in the course of illness when viral shedding may be high. Fever and cough and difficulty breathing are some of the primary symptoms that have been described in people with COVID-19, but these symptoms may not be the first signs or the first symptoms of COVID-19. In fact, fever may not develop until several days into illness. Some of the very early signs of COVID-19 can include more vague or general flu-like symptoms, including someone feeling just simply tired, run down, maybe having a headache, having chills but without a fever. We know that people can transmit this new coronavirus even with those very early and very mild symptoms. Therefore, I just want to stress that it's important for people to take appropriate steps and precautions to protect our families and our communities, and at the first symptoms of not feeling well, to stay home. This should involve employers who screen their employees for symptoms before work, and if employees are identified who are maybe feeling unwell or having mild symptoms, they should be sent home. So I think we need to change our social expectations and make it okay for people to go out, make it okay for people to stay home when they are sick or symptomatic, even with only mild symptoms. As you can see on the chart on my right, most of the people who get COVID-19 will only develop very mild symptoms. In fact, more than 80% of people who have been found to have COVID-19 do not require hospitalization and have very only mild symptoms and recover at home. That is, in fact, the case with the 13 individuals in New Hampshire who are all isolated at home. None of them have required hospitalization. But I do want to point out that there are certain groups that are at higher risk. So what we've seen from the national and global pandemic is that anywhere about 15 to 20% of people will have more severe illness and require either hospitalization for supportive care, such as oxygen or intravenous hydration and fluids, or potentially more critical level care in an intensive care unit. These populations that are at highest risk for more severe illness are those who are of an older age, that being individuals 60 years of age and older, and people with multiple medical problems or chronic medical problems, regardless of the age of the individual. It's these individuals in particular that we want to try and protect within our communities. And so even if someone is only having mild illness, they can still likely transmit it to others. Hence the need to take special precautions to protect our more vulnerable populations. Anybody that does fall into this higher risk group, meaning people that are 60 years of age and older or people with chronic medical conditions, we urge them to avoid large gatherings and practice social distancing. We also urge them to avoid any non-essential international or domestic travel, which is consistent with current CDC guidance. And I would instruct everybody, if they're considering traveling, to review the guidance on the CDC webpage. There's been a lot of discussion about whether we can contain this virus or whether we're going to try and mitigate the spread. And I want to emphasize again that it's really not one or the other. We are continuing with our containment efforts to limit the spread of this virus, while at the same time working with our healthcare systems to make sure that they are prepared for any needed surge in patients and patients who need more intensive care or hospitalization. There's another graphic on my right up here which looks at the goals of mitigation, which have three general goals. One is to delay the delay the peak of an outbreak and slow the acceleration of new cases coming into our state. We want to reduce the number of cases and the burden on our healthcare system so that our healthcare systems and emergency departments don't get overwhelmed. And we want to reduce the overall number of infections and health impacts within our population. So, again, I want to stress that with these new identifications, all of them, we believe, are either travel-related or connected to or are a direct contact of someone diagnosed with COVID-19. We will continue our public health efforts to investigate and try and slow and contain the spread of this virus. But again, it's likely we will see increasing number of cases in the coming days and weeks. And so we are working with our community partners, with our healthcare systems, with our state partners, in order to reduce the impact of this global pandemic on our communities and citizens and residents of New Hampshire. So with that, I'm going to hand it back over to the governor. Thank you very much.
Thank you, Dr. Chan. Well, thank you very, very much, Dr. Chan. So given these very serious developments, our understanding is that this is clearly a rapidly evolving situation. Today I'm directing all schools in New Hampshire to transition to a remote learning environment effective immediately. Many school districts are already prepared. Others will need a few days to begin. Regardless, every district will have 1 week to fully transition to this new learning environment. The Department of Education stands ready to assist all schools in bringing these efforts up to speed so that the education of our children in New Hampshire will not be disrupted. We have worked many years to be a leader in remote learning, and Commissioner Edelblut and his team again are to be commended for their efforts. They put us in a very strong position to take these actions today. We work very carefully to ensure many of the other issues that surround this change are addressed, such as food insecurity, workforce issues, IEPs, child care, child welfare services. All of these issues have been worked over the past few days and, frankly, the weeks and months leading into this by Commissioner Edelblut and his team at Department of Education to make sure that we're going to be there for these kids. This directive will remain in place for 3 weeks through April 3rd, and following that we will reassess the situation on the ground. However, districts need to appreciate that they may remain in this situation for an extended period. So to be clear, while students will not be in schools, they will be learning, and education in New Hampshire will go on. I'll now ask Commissioner Edelblut to join us to talk about some of the details of the plan.
Thank you. Thank you, Governor. I would first like to commend our school leaders of New Hampshire who have been working tirelessly really to be able to tackle the circumstances that are on the ground and the exigent circumstances that we find ourselves in, to be creative, to be innovative in terms of working towards solution so we can continue to work with our students and our families. It is an evolving circumstance on the ground. And so I want to describe what we mean by changing the environment in which our students will learn. And that includes the idea of remote instruction plus remote support results in remote learning for our students. We all know that students are always learning, and our goal is to help them learn the important knowledge and skills that will bring them all to bright futures. Relative to remote instruction, on February 12th, this last Thursday, the State Board of Education passed an emergency rule that allows schools to implement remote instruction in their learning environments. The range of implementation with regard to remote instruction we know will be quite broad. There are some districts who are up and running at a moment's notice. They are fully digitized and are able to deploy technology in ways that can engage their students. Other districts are going to be using hybrid methods of some Chromebooks and some instructional materials that will be analog, and some districts may be fully analog. I sometimes joke with some of the superintendents that we have that it was not too long ago that some of us lived in a world which did not have computers in ubiquitous ways, and we managed to learn quite well. So we are working with our schools in many ways. We have rolled out a number of tools to them, and we are continuing to roll out a number of tools in support of our schools. Particular emphasis in this remote instructional model is on the digital divide and making sure that we do not leave any of our students behind. Relative to remote support, there are two areas of focus. One is relative to some of the food programs that we have in our schools for some of our needy citizens. Early on in this process, the Department of Education applied for a waiver. That waiver was granted to us and received the waiver yesterday that really, from the USDA, that allows broad flexibility in terms of how we prepare and distribute food through our food programs. Another aspect, really, of remote support deals with our students that are on individual education plans. And so we are finding ways in order to be able to continue to support all of our students, particularly our students that may have a learning disability. That may mean that the service that is called out in their plan can be provided in a remote instructional environment, and we will continue to provide it that way. It may mean that some of those services need to be done in person. In those cases, we will continue to work as a school and bring in students in limited cohort sizes, maybe even 1 or 2 or 5, to be able to provide those individual education plan services in that school environment. And then finally, there may be some services called for in an IEP that we are simply not able to provide in a remote support model, and in those cases we will work with the individual students on compensatory services. Now, our plan, as the governor alluded to, is that beginning tomorrow, students will not show up at school. So starting on March 16th for up to 1 week, schools will be preparing remote instruction and support. I can tell you, having had conversations with many of our schools across the state, some already having launched into remote instruction and support, some needing 1 or 2 days to launch into remote instruction and support, and others may take the entire week to prepare to do remote instruction and support with their students. That implementation go live will be next Monday, at which point remote instruction and support will be available ubiquitously across the state is our objective. That time frame for that will last through April 3rd, at which point we will reevaluate the situation on the ground and determine what we will do, recognizing that the disrupted model and the remote instruction and support may last through the end of the semester. We recognize that this is a disruption not only for our students, but for our parents, for employers, for our school leaders, our educators who have worked diligently to prepare curricular materials for their students, and they are working tirelessly to adjust and to be flexible to be able to deliver high-quality educational opportunities to our students. I think it is vital that we continue to work within our communities and support one another throughout this public health emergency. We all have a role to play, and I am proud of how the education system has responded to these circumstances.
Thank you very much, Commissioner. This has been really an all-hands effort across the state, and we can't thank the folks within the Department of Education, the superintendents, all the way down to the principals in a lot of these districts for help laying the groundwork for this statewide, as well as giving the feedback to us kind of at the top level to make sure that we're working out all the kinks and the bugs as we go forward. But we have a lot of hopes that this is going to be very successful for everyone across New Hampshire. So we don't take today's actions regarding...
Okay, there you go on that press conference. If you want to watch the full press conference, we will share the link with you after this broadcast on the Right Linking Network Facebook page. COVID-19 coronavirus in New Hampshire. What you need to know. Officials detail symptoms and number of cases. 13 Granite Staters have tested positive for coronavirus disease, COVID-19, which was first detected in Wuhan City, China. New Hampshire data. Number of positive COVID-19 tests, 13. CDC has confirmed 2 of them. Number of pending COVID-19 tests, 95. Number of negative COVID-19 tests, at least 212. Number of people tested, 380. In number of people being monitored, 450. On March 11th, the World Health Organization declared COVID-19 outbreak a pandemic. All 13 patients have not been hospitalized and are resting at home with mild symptoms, health officials said. Emergency Operations Center in New Hampshire now open. The center will be open from 7 a.m. to 7 p.m. 7 days a week. Symptoms. Officials said symptoms might appear in a few as 2 days or as long as 14 days after exposure. Symptoms include fever, cough, and difficult breathing. Prevention. What to do if you are sick. Insurance information. How testing works. Again, 13 people in New Hampshire who have tested positive for COVID-19. Let's take a look at these areas. 3 in Grafton, 9 in Rockingham, and 1 in Hillsborough. Be sure to stay with the Riley King Network on the latest of COVID-19, everything you need to know. Loon, several other New England ski resorts close for season due to the coronavirus outbreak across the globe. Coronavirus in Massachusetts, Sunday, March 15th, update. New cases, 26. Total cases, 164. Biogen/contact linked cases, 108. Also, Boston mayor declares emergency public health. Boston Mayor Marty Walsh declares public health emergency, orders city bars and restaurants to reduce capacity in half, orders 11 p.m. closing times, and urges deliveries. Health officials announced 5 presumptive coronavirus cases in Maine. There are 7 confirmed, 5 presumptive positive cases in Maine. And also, many schools across the United States are closing due to this widespread virus. New York State reports its first 2 fatalities. Let's take a listen to that video from ABC News.
For information and testing for the sick, so many people taking officials' warning seriously and hunkering down now at home, hoping to stop the spiral of cases. New York State reporting its first 2 fatalities. Here's ABC's Diane Macedo.
Tonight, New York is reporting its first 2 coronavirus deaths as COVID-19 spreads across the country. Mayor Bill de Blasio confirms an 82-year-old woman died after being admitted to the hospital last week in critical condition. She was also battling advanced emphysema. It's unknown how she got COVID-19. And another 65-year-old victim with underlying health issues died in Rockland County.
We're going into a full crisis footing. This is a wartime dynamic.
New York State is now reporting 524 cases.
This is a virus that does not threaten all segments of our society equally.
This map shows what nationwide cases looked like just 2 weeks ago. At the time, the virus was confirmed in just 9 states, and the first death had just been announced in Washington. Tonight, 49 states are confirming cases, plus the District of Columbia, with more than 50 deaths nationwide. West Virginia is now the only state with no reported cases of COVID-19. The common complaint? Lack of thorough testing.
We don't feel like we have enough tests. I don't think anybody feels like they have enough tests right now.
Local governments are trying to catch up with drive-through testing sites in San Francisco, Seattle, Denver, Birmingham, all the way to New Rochelle, New York, where residents with symptoms have to call a hotline to schedule a test. Each city has a different protocol. Meanwhile, the president is promising a website to help streamline the testing process. But tonight, questions are mounting about that. This is nationwide. At least 46,000 schools have closed, keeping some 26 million students at home. For the first time ever, Apple is closing all of its stores worldwide, with the exception of China, for 2 weeks. And tonight, retailers say they're working with suppliers to keep up with heavy demand for cleaning supplies, toilet paper, and hand sanitizer.
We're still replenishing it and shipping it, but as soon as it hits the stores, it's going.
All right, Diane Macedo joins us now live from Times Square. And Diane, we are just getting some breaking news in, as you were reporting there, about an outbreak not too far from Times Square in nearby New Jersey.
That's right, Tom. Teaneck, New Jersey is reporting 18 cases. The mayor there is now asking people to quarantine there and not leave their homes unless absolutely necessary. He says he believes people may have been walking around with cases for 4 weeks now. So again, Teaneck, New Jersey, asking residents there to self-quarantine, using the language that this is now ground zero for this virus. Tom?
Diane Macedo with that breaking news just in tonight. All right, Diane, thank you.
Okay, and there you go on that video and that report. And that does it for this evening edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your Sunday evening, and thank you for watching. I'll have a news report coming up in a little bit, and I'll see you back here bright and early tomorrow morning for another broadcast of the Riley King Newscast. Good night and bye, everyone.